Hi. I just came across a video that Tom Powell Jr. put out, and it. I'm going to link it. I'm going to put it in the in my description. So please check him out. He's a great content provider. At least I enjoy his content. It does go off the rails sometimes, but these are unprecedented times. What can I tell you? I love you, Tom. And Renee, I'm with you. Um, This one was about a mom who had dementia who sold her car. And I looked at some of the very judgmental um, statements in there. Now, I am a former RN. I have done extra work on the side in home care. Um, and as also a daughter of someone who had dementia. Uh, how did the mom get to the keys of the car? How was mom able to drive the car and sell the car? All right, let me cover some things here, okay? When a person has dementia, it doesn't mean they don't know how to drive anymore or they don't know how to walk and chew gum at the same time. Dementia, depending on the dementia, involves, yes, memory loss. It also can involve executive functioning. You don't make decisions the correct way, or are able to have coherent decision making. For those who were blaming the daughters who have power of attorney over the mom, no, you can't watch people every time, every minute of the day. It's just feasibly impossible. And with dementia patients, depending on the severity, there can be lucid moments. And mom was able to get to those keys without the daughter knowing. And she took herself on a ride and she came home with a new ride. And like I said, you got to see Tom's video. Look, we all hear of those patients with dementia who get lost, who go out walking in the snow or go out walking anywhere and just get lost. And it happens. It happens. It's why when you go to a nursing home, you see that there are alarms on the doors so that these patients can't get out and wander. Does it happen? Yes, it still happens. In one place that I had worked at after my move, an elderly woman got out and got lost and wound up back where she lived once before, her old home, because she knew how to get there. All right. Luckily, the homeowner knew and contacted us and was very lovely, kept her busy until we could come and pick her up. Okay. It does happen. My suggestion with car keys and things like that is to lock them away in a place that's not normal. If you have to get an actual lock, lock it. Lock it. Put alarms on your doors and on your windows, because there's a way that they can get out. They're very resilient, some of them, and quite imaginative. Yeah. Ask any home healthcare professional, ask anyone that deals with geriatrics. They can tell you. The other thing is medications can make somebody who is normally lucid not. Um, I know of a dear, dear old man from my past in one of my home health care where he was given morphine and it did not really work well on him. And he went back to his youth. And while we can kind of laugh about it, it's not so funny in other circumstances with other people. I had one poor woman who was screaming in her bed that she was being attacked by the man. And the nurses were trying to figure out who she was talking about because we only put female with female. And this was middle of the night. And so while everybody was running around, I'm talking to her. And she said, he keeps grabbing my legs. Well, this woman had had surgery. And it's compression to help with flow of blood from her lower extremities up. She had had, I believe it was hip surgery. I don't remember. But I do remember the circumstances where this would simulate somebody grabbing her by her legs. And I said, where's the man? And she pointed to her neighbor's TV. And up in the corner, there was a man on the screen talking. She was also given morphine. So these things can happen. There are even elderly people who are very lucid that I have worked with, again, who have an infection, but they don't present an infection the way you and I would. We don't get the fever. They don't get the feelings of where they're not feeling right. And you know, oh, maybe it's a UTI. They can't tell you that they are having trouble peeing or that it burns or anything like that. Pneumonia. So when you start to see that there's changes in cognition with your elderly loved one, if a dementia diagnosis is made, look it up. Take all the precautions you can. And if you can't handle it, then think about getting some care in. Because being at home is less upsetting to them. When it gets past a certain point, though, sometimes it's best to let them go to a facility. That's not throwing away. That's caring. That's loving. That's being kind. With infections and things like that, normally they get on their antibiotics and they're cleared right up. And they're back to their normal self. So just be aware. Okay? And in the case of these daughters and their mom, the car dealership was in the wrong. I believe they do have a lawsuit. They did manage to work it out, apparently. But yeah, the mom was being fleeced. You have a good day, though. Please like and subscribe. I'd greatly appreciate it.